Great. Thanks for your interest in submitting a case report to CureID. Remember that when you're entering information about the symptoms and treatments, it's okay to focus on those which most severely affected the patient's quality of life or which the treatment had the most significant impact on, either positive or negative. While we'd welcome as much detail as you're willing and able to provide about the patient's symptoms and treatments, we know many patients with rare genetic disorders have complex treatment histories, and that entering all of these details may not be feasible. So please don't let this dissuade you. Enter what you can and what you feel is most important for other patients, care partners, and clinicians to know. Remember that you can always save and exit at any point and return to your case later by clicking the Save and Exit button in the top right corner of your screen. You can also find your case again later by going to Account and viewing My Submissions. When you want to edit your case, click the 3 vertical dots, then click the pencil icon that says Edit. Note that your case automatically saves along the way whenever you click the Continue button. Therefore, if you ever need your case, even if you haven't clicked Save and Exit or Submit, your information will not be lost. Visit your account and My Submissions to view your saved case entry. All right, we're ready to dive into the case report itself now. Start by clicking Continue at the bottom of the screen. You can navigate throughout the case report form in 2 ways, either by clicking Continue and Back at the bottom of each page, or by using the menu bar on the left to move between sections of the case report form. We begin by asking about the patient's demographics, whether they were born prematurely, the sex they were assigned at birth, the country the patient was treated in, and their race and ethnicity. Click Continue to move between screens after answering some or all of the questions. For example, I will say that the patient was 7 to 11 months old, that they were born prematurely, and that they were assigned the male sex at birth. Then I'll click Continue, selecting United States as the country, race ethnicity as Black or African American, and that the patient's ethnicity is Hispanic or Latina, and then proceed to continue. The following pages ask about the patient's disease presentation, including what findings the patient presented with, and selecting from each of the therapeutic categories, such as cardiac or gastrointestinal, all of the conditions which apply. So here I may choose to select hypertrophic cardiomyopathy with symptoms under cardiac, difficulty gaining weight and failure to thrive under endocrine and growth, gut rotation under gastrointestinal, and so on. For each category, you can also enter additional information in the other section if there is pertinent information to include. Select outside to continue, and then hit the Continue button. The next question asks you to describe if there were complications during the patient's mother's pregnancy that led to fetal findings, and if so, what those fetal findings were. So if the patient experienced complications with fetal findings, you could select them from the dropdown or from the checkboxes here, and there is an option for other. Select Continue to proceed to the next page. On this page, you're asked how the diagnosis was made and which gene or genes were found to have variants of significance if the diagnosis was made via gene sequencing. Select from the list any of the pertinent genetic mutations. In addition, you're asked what specific nucleotide change or specific protein change occurred. And please enter this information here in the free text boxes if the information is known. Select Continue to proceed. We'll stop here for today and continue with the next video to see how the information entered about the patient's medications as well as their treatment outcomes. Thank you for your interest and for sharing your treatment experience on CureID.